presence reflects a truly international community committed to advancing education and leadership. We will begin the first part of this session in an interview format, followed by a dedicated Q&A segment where you will have the opportunity to ask questions live. We are incredibly fortunate to have Professor Tonks Fawcett from the University of Edinburgh with us today, whose work exemplifies leadership, vision, and dedication to nursing education. She has made profound contributions to supporting nursing students in clinical settings and advancing clinical decision-making. Her expertise spans cancer care and survivorship, pain management, and the impact of stress on nursing practice. On a personal note, she is a dear friend and a mentor of mine. So please join me in giving a warm virtual welcome to Professor Tonks Fawcett.
Thank you.
Okay. Then let's dive in today's session. So for this first section, I would like to chat about teaching and student engagement.
Yeah.
So the first question that I got was, what advice would you give to a student who has just started nursing to make the most of their time at university during clinical placements?
Oh, that's a really good question to begin with, and thank you so much for inviting me this morning. Making the most of any course of education is absolutely vital. So what I always want to know is how motivated is the student to want to do whatever course they're doing. So the first thing about any nursing course which involves academic work and clinical placements is that fundamental motivation to want to be a nurse, to want to care, to want to put patients first. But probably from an educational perspective, we really focus on the knowledge you need to achieve all those ambitions. If we're really all going to be good nurses, we've got to constantly be curious, constantly want more knowledge, constantly want more experience. So when you're taking a practice-based course like nursing, you're learning different things when you're learning experientially on the ward situation or in a community setting than when you're sitting in a tutorial or even a formal lecture or a discussion group. And one of the joys about nursing is we can blend both forms of learning. So it's really having that insight to realize that the academic side will furnish you with the knowledge and the theory underpinning the skills to be an excellent nurse. But when you're out on placement, you're putting that into practice and you're actually experiencing the care and finding the best way to learn that care. And we all learn differently. And as a teacher, one of the things I had to learn was that nobody necessarily learned the way I learned. And you tend to think that the way you like to learn is the way they will like to learn. So in the clinical areas, making sure that I understood where the student was coming from, how they approached learning skills, and realizing that some like to have the skill and then look at the theory behind it, and others wanted to have the theory and then apply it to the skill. So as teachers, educators, we must be flexible. We must be where the student is at, and the learner must be ready to learn. If you can get that balance correct, then the learning is really facilitated beautifully. Sometimes it works and sometimes it doesn't, but we almost must aim high. Does that answer that part of the question, Aaron?
Does. I think that which leads to the second question about being curious and the engagement. I think nowadays with the advancements of technology and a lot of like short format content on social media, I notice some students, if not most students, have shorter and shorter um, uh, concentration or
Attention.
yeah, that's the word, attention span.
Yes,
Um,
indeed.
so like what teaching methods have you found most effective for engaging today's students?
Yes, and the teaching methods are so important to underpin your teaching, but they mustn't dominate your teaching. And probably following my previous answer, I would look for myself in the teaching, particularly in the placement setting, is to Cole's experiential learning. And that's where we're trying to focus on the experience the student's having, perhaps with a skill, or with a patient experience and something they're unfamiliar with, seeing how it is looked after, how it is sorted, how it is carried out, reflecting on it, thinking about how they can support that with their theory, and then trying it out and advancing their skills. And most of you will be aware of the experiential learning cycle, but it's that key part of reflection. So that when you have an experience, you don't just move on and on to the next one. You think, I had this procedure to carry out. How did I carry it out? Why was it that I wasn't so effective as my preceptor or my mentor? What do I need to learn to make that skill perform better the next time? Do I need to ask questions of my peers or of my tutors? Do I need to go back and read more? Or is it just a function of time? And the more I do it, the easier it will come. But it's really important to have that reflective component that we all do every day in our lives. We do something, think, oh, that didn't work very well, and we think again. So if you want a particular teaching method, it would be the experiential learning. But attention span is something that you alluded to, which is really so important. I think you can always hold a student's attention in the clinical area because it's so acute and there. It's holding their attention when you're standing up over to a class, and it's getting that engagement, it's getting that ownership of knowledge when perhaps you're giving a more formal lecture. And I know that you and I, Erin, have had these discussions about how do we acquire knowledge if we're not going to really take the wisdom of our lecturers and our teachers that have gone before us, and say, well, let them do it, let them work it out. So there is a part of learning where you do have to absorb new knowledge and actually just have that foundational knowledge, have that fundamental knowledge to help you practice, because you must have knowledge to be able to work critically with. It's wonderful to say we want critical thinkers, which, oh my goodness, we do, but they've got to have that knowledge to be able to know what to work with. So there is a certain amount of education where it is fairly didactic. You've got to transmit knowledge, but it's making your students engage with that knowledge you're transmitting by illustrating the knowledge by stories or your nursing care, or I'm always doing it, telling them stories of my own nursing career, and of course I love telling them it, and using humor or asking them what they think about something. So you bring them in. You don't just stand there for an hour talking at them. They don't like being talked at, students. You've got to make them have that ownership of the knowledge you're trying to transmit. You could argue it's tougher because it takes application. There's an expression in English, which is it takes the seat of the pants to the seat of the chair to really acquire that sort of knowledge. So it isn't always easy, but if you're motivated, if you're curious, and once you've got that knowledge and you find yourself able to use it to underpin your practice, the rewards are legion. So I'm not saying it isn't tough. It doesn't mean that everything's going to be easy and just a little bit of trying it out. There is knowledge to be acquired, and that takes effort and commitment. But holding a student's attention is important, because an article I was reading just yesterday that said it was now 8 minutes, probably maximum, that you could hold the attention of your students. So break it up, have visual things in your lectures, and interrupt your teaching with a video clip or something to keep their attention, but bring them in, make them own their knowledge, and link to how it will affect how they practice and how it improves their patient care. Making it relevant, that's what holds their attention. And you'll soon know if you're successful, because you will have their attention, even if you're transmitting quite an amount of knowledge, and it might be quite complicated knowledge, because nursing is a complex profession and the knowledge and skills we need are equally complex. That's why we need higher education for nurses, why we need a global agenda, and all the things that will make us into good nurses in the end.
And there's something else that I think, through my observation of your teaching style, it's the distance between the lecturer and the student. Some Most of the times I find that a lot of teachers or lecturers, they would stand at the podium and just um
Talk.
recite or talk, yes, but I find it very engaging when professors, teachers, they walk into the audience, they walk closer to the student. It's an instant grab of the attention of the student to be like, listen to me now.
Indeed, I know I do it, but I don't know all the audience. I don't know you all. I'd love to know you all individually, but I do know that students try to avoid the front row. And it's rather like when I was a child going to church with my parents, and that they would always march us down to the front row, and we thought, oh no, couldn't we go back a bit further? Students never want to come to the front row. So I say, well, you won't escape me because I'm going to walk down into you. And I enjoy doing that because then I can actually be beside them rather than standing up in front and looking at them. Um, Sometimes it's impossible the way the lecture room is laid out. Doesn't facilitate that, but I do try to. And then you're with them and you're working alongside them. And I think when you've got a little bit of closer proximity, your student is more likely to say what they don't understand, rather than asking from a distance. And then I'm not going to say because there's all my peers around me. But if you go up close and personal, they're more likely to say, well, I didn't understand this bit. And that's what, as a teacher, you want. You want to know how much they're understanding and how much is difficult and where you need to go back again and revise what you said.
I think that's a very, very important component. So let's move on to the next question. So, how do you motivate students to change behaviors and habits, particularly in relation to respectful patient care during the process of unlearning and relearning?
Yes, this was a very interesting question, which I saw and thought, oh my goodness, I don't think I've been asked that question before. But I think fundamentally, dignity and respect is at the heart of our nursing practice. However informal and relaxed we may be, it is that dignity of our patients and respect for their unique way that they behave that we have to always be aware of. And sometimes for a new student, they find it very difficult to know how to be with a patient. I don't know if any of your audience would agree with that. I did have a student a few years back in an oncology ward, and he said, I just am nervous. I can go in and do the observations, but I don't know how to talk to them. I don't know what to say. And I felt very sorry for him because it hadn't crossed my mind that he might find this difficult. So I said, well, just come with me. And we went into the 4-bedded bay, and all I did was chatter and just make light-hearted conversation. And then he joined in, and then there was a connection. He actually came from Hong Kong, and one of the patients had been in Hong Kong, and suddenly there was a connection. And he had an understanding of the patients he was looking after because of small talk and little light conversations that allowed him to understand that unique individual and recognize the dignity of the patient and the respect he had for them. But some students do find it difficult, and you talk about unlearning and relearning. I think if you see behavior or practice that isn't ideal, you don't, well, I would not directly correct a student in the setting. I would try and divert it. And then at a debrief, which I think is so important, if after an experience with your tutor or your preceptor or the charge nurse, you get a chance to go over what you did and explore it. And that would be where I would try and explore why they behaved in the way they did. And perhaps were a bit too familiar, a bit too casual. Perhaps their choice of language might have seemed okay to them, but wasn't okay for the patient. So that you always need to feel that you are understanding why they behaved the way they did. And then alongside them, so that they take ownership of the relearning, you ask them to think about other ways they might do it, or to explore how that might have been heard by the patient, or if they were a little bit awkward with their manual handling skills and perhaps it was uncomfortable, that you can explore with them how they can improve that skill. And could they see how it was perhaps a bit painful for the patient, anything like that. But it is really having those values. And if anything is values driven, it's nursing. So making sure that they have the right values, and then you can incrementally improve their actual behavior, their knowledge, or their skills. Does that answer your question? I'm not sure if I've understood it as well as I should have done, but it's going back to their motivation.
Yes, I think it does. I mean, a lot of the times I find uh, in relation to being respectful when providing patient care, I think there's a fine line, and oftentimes I find nursing students hard to manage like their bodily boundaries when it comes to patient care,
Yeah.
the the distance even how to navigate a lot of the caring process during like their placements. And I
Yes.
guess a lot of
It's a lot of personal care. And for some nursing students have grown up in that sort of world, and probably half why they chose nursing. But for some wonderfully dedicated nurses to be, this is new territory. And you're right, the boundaries, the personal care, the intimacy, the things that have to go on behind screens, can be quite difficult for them. And if one senses you have a student, especially in their very early days, who feels really quite shy, quite embarrassed, uncertain of how to do it, that is respectful, then the primacy of having an experienced nurse work with them in those early days is so important. And I would say that any new placement, when a student goes for the first few days, they should be shadowing someone with expertise. It will pay back dividends rather than saying, just go and work it out. So the investment in supporting a student, whether it's to do with personal care or just to do with perhaps more intensive care, and they're looking nervously at the pumps and the IV lines and the monitors and thinking, oh my goodness me, we as more experienced nurses and educators must pick up these cues, must be able to see someone who doesn't want to say, actually, I'm a bit scared. To actually preempt that by saying, come with me, I will be with you, I will talk you through it all, we'll talk to our patient, we'll see how he's experiencing it. If he can cope with all this paraphernalia around him, I'm sure you can. Little gentle humour, take them through it, help them feel secure. And then the business about the personal space and the body falls into place because you've seen a role model that you respect, which really leads on to the importance of role models, because role models may not necessarily be good. So you always should qualify a good role model, not just a role model. But they can play a huge part. I mean, I have a terribly long memory, but I can remember my days as an early student and many days when I thought, oh my goodness, what if I harm the patient? And that was, what was really at the top of my mind. But it must have been on my face because I was well looked after. And that's what I valued so much and what I knew helped me. I want to pass on to the students that I'm looking after, because I was very fortunate in the program I had. So,
that's just fabulous. So speaking of support, and let's transition to the practice part. If you were asked to design an introduction or transitional program for early career nurses, what key aspects would you
oh,
prioritize?
yeah, I did look at that, I thought, oh my goodness, that will take me 6 months. But but briefly, the most important thing about a comprehensive orientation program or a preceptorship program for a newly graduated nurse is really what I'm thinking of. I think that's what you were asking. Is they must know the purpose. Why are they going on this program? What is it for? So that they can engage with it and share the journey. And will be motivated rather than thinking, well, I don't know, I thought I'd just registered as a nurse. Why do I need this program? And others will be thinking, oh, please help me on every step of the way. So it's having these shared understandings, shared values, shared objectives, and hopefully the desired outcomes. Some of these programs within hospitals are almost predetermined, but I think if you're looking at sort of the priorities, the first thing I would want to know is their skill set and whether the skill set matches where the appointment they've got in the area they're going to care for, and looking to assess their competence to see what it is we need to concentrate on, whether there's any compensation, whether there's any areas we need to emphasize for them to get upskilled a bit. or just refresh what they're doing. Sometimes these orientation programs and preceptorship programs can involve simulation learning just to get them up to speed in a skill that they perhaps feel is required in their appointment and their job, but they don't actually have or haven't had so much experience in it. You need a good preceptor. You need someone that will give regular feedback to the newly graduated nurse, who will give them encouragement and say, I can see how you're moving on, will encourage them to read and back up what they're learning, will be able to demonstrate good role modeling, but will also, this probably sounds a bit soft, but it's very important, will also give that preceptee the emotional support they need and the support of being in this situation when they are now an employee. They are responsible and they've got to be accountable for their practice. So giving them the emotional support, but sometimes the support from their peers, the other nurses, registered nurses in the clinical area, can be wonderful. And a preceptorship program can facilitate that, which is really nice. And part of it, again, is helping that newly graduated nurse with their own professional development, what they're looking to achieve, what their career pathway might be, because it might be different. They might be looking at this post that they're having for a short time, or this might be their career aspiration, so that you're actually with them on their professional development, and then just thinking about guidance for that and what they might need to do to pursue their career aspirations. Other things are very practical. There's no getting away from it. In a preceptorship program, they need to understand things like time management. We don't have a lot of time. We've got to be economical and effective. We had a project here in Edinburgh called Releasing Time to Care, which was actually about the efficiency of nurses such that it freed them up to have time to sit and talk with their patients. And the blend of the two was wonderful. It wasn't easy, but it was wonderful. Other aspects, of course, are patient safety and quality care. They go together so much. But achieving all this through reflections, through debrief, discussions, looking at possible mistakes and possible errors. I mean, the orientation to the area will have highlighted all the safety aspects, and that's axiomatic in any placement when you're new. But looking at how we might avert errors and how we might minimize them would be part of the program. You don't want to focus on the negative, but it's really important to demonstrate how you will ensure patient safety. And then I think the last thing I'd want from any preceptorship program or induction program I run is I would want the preceptee's evaluation. I'd want to know what worked for them and what didn't work. And I think we as educators must be flexible. We mustn't think, well, this is the way we do it and it's policy driven and we have to do it this way. If you get feedback that helps you reflect and think, well, I wonder if we could do this a better way, or I wonder if we could give more ownership to the preceptee to develop their own learning rather than tell them this is how it's going to be. So those would be my main things, and recognizing the diversity of the preceptee group. There may be 2 or 3 newly graduated nurses that you're running a program for, and their learning needs might be very different. So it's trying to be all things, but it's difficult. I don't know if that helps, but I certainly would make sure it was nicely structured so that they could see where it was going and what the goals were, but keep it very fluid, and so that they can make their own developmental journey and enjoy their nursing when they come out the other end, feeling supported, skilled, knowledgeable for this particular area of care. So.
Specifically, I think I agree with the support part, because for the programs that I've seen so far, a lot of them inside hospitals, they are trying to accelerate the process of them to become essentially labor or human capital value of the ward or the unit. And somehow it is less focused or emphasized when it comes to like the peer support, or even why we do nursing, the motivation part, which is quite a sad reality sometimes.
Yes. I mean, you've got to love it to be a nurse. You know, you really have. And fundamentally, you know, you must like people, and you must like people when they're not at their best, and like people when they cannot always be grateful, or like people when they're too old and confused to be able to show appreciation. And part of that is knowledge and understanding that you want to give the best of care, even if they aren't in a position to appreciate it verbally to you. It doesn't want to make nurses sound as though they're just perfect angels, but it is part of our professional responsibility. You touched on another thing I think is more a personal view, but we here in the UK are giving our student nurses far more skills at pre-registration level than happened in my day, or even 10 years ago. And I get concerned about this. The students love acquiring skills. They have this sense of status, prestige, and self-worth, equating to the number and extent of skills they can do. But actually, once they have acquired those skills, they realize the most important skills are not those, but what we might call the soft skills, the communication skills, the interpersonal skills, the sensitivity, the things, the invisible skills, the decision-making skills. Because the actual psychomotor skills or the clinical skills are just tools which we must use very, very well to a higher standard, but they're just enablers for us to give the nursing care, which is all these more invisible professional skills that separate out someone who has a really patient-centered approach from someone who has a very skilled nursing approach, if you can see the difference. Though I have had students in the past who say, I'm not really a very touchy-feely person, Tonks, but I want to give them good care by being really competent. And my showing that I care for them is through my competence. So even when I've just said what I've said, I have to recognize that some nurses are different. So it's always recognized that we're all unique and you work with each unique individual. But I do worry a little bit about accelerating the skills without the underlying knowledge and experience to match it. And then they might become a new staff nurse here, and they haven't really got the skills to run a ward, to deal with discharge planning, to talk to a troubled patient's relative, and these sort of skills that are so important because they've been preoccupied with the IV infusion devices and the pumps and the monitors, etc., which when they find those skills and have got them under their skin and feel quite comfortable with them, they realize they aren't the be-all and end-all. They're just a means to giving good nursing care. Does that make sense to all of you? I hope so. Do put questions in if you think you don't know what I mean.
I think it definitely does. There's a lot of hearts like popping up on the screens. Yeah. So then let's move on to mentorship and clinical challenges. So this is quite a controversial question. Some senior clinical instructors suggest that considering time, resources, and even their own sense of achievement as mentors, they should focus more on students with higher potential and stronger professional identity, while other students may receive less attention or being overlooked. What is your perspective on this approach?
Oh, I looked at that question and I thought, oh, it is so difficult. It is always a joy to teach those with really high potential, quickly acquiring knowledge, seeming to have it all worked out very quickly. That she or he will make such a wonderful nurse. I must devote my efforts to, enhance this. But actually, it is those that are struggling a bit more that probably need our attention if they really are wanting to nurse, if they are motivated, if this is what they want to do, but they are not quite so dexterous. So find the skill of just giving an intramuscular injection took them a long time, but they really wanted to give the best injection in the world. I would give them all that time because it's their fundamental values that I'm concerned about. But the high flyers are a joy. You can't deny that. But actually, if you like, in the end, if you've got a student who really wants to be a good nurse, but it takes them longer and they seem like lower achievers, if you can assess and think they really deserve extra input to make sure they achieve the same outcomes as the very smart, fast-moving learners, I would give them all that. So I'm not sure that I would focus on the students with higher potential, because I'm not sure the ones that perhaps superficially look as though they haven't got the potential have. Their learning curve is different. And that's where you might want to sit with them and debrief over an experience and say, tell me why you find drawing up an injection or putting together the equipment so difficult, and let them talk it out. And if you can always see that they want to be a good nurse, that's worth the effort. That said, I do find it always a challenge if I sense the student really is in the wrong career, who doesn't really want to do it, who you think might have entered nursing for the wrong reasons, or might have entered nursing with an idea about the profession that isn't a reality. I mean, there still exists a very old-fashioned romantic view, which sadly is not the reality out there. It is hard work and tough, and it needs people with commitment and drive and passion, always passion to do your best. And it would be that passion that would drive me with what I decided to do. But if they weren't sounding as though they wanted to be a nurse, I would explore that with them. Because sometimes, and we all know this, that there are student nurses who know they've made a mistake and know this wasn't the career for them, and they haven't got the courage to say, because they think it will be letting them down or will be perceived as failure. And I always say, no, you have one precious life. You must do it what is best for your career and you. And if nursing is not for you, be brave enough to say. And you shouldn't even need to be brave, because we just want to get them on the pathway that's best for them. Does that help? Because I
Yes.
just walked around that question.
Because I think it made me think of a thing that when I was in my undergrad, one of our lecturer once said, because I feel like nursing students in Taiwan, maybe when they sense there's something wrong or they're not fit or they're not cut up for this profession, they would just um try to run away as fast as possible. But somehow I remember a lecturer told us that if you don't hate it, try to bear with it for a while. So
Because you
I think
might
that's
come to
this.
love it.
Yeah, I guess it's a different strategy on keeping their students. And the other thing is, I think that you brought a really insightful angle when viewing these questions. I recall hearing a lot of different professor.
Okay.
Yeah, I think it's stable. A lot of different people talking about there's no bad nurses, there's bad environments. So when it comes to this education aspect, um, I would argue that there's no bad students. There's ill-fitted teaching and learning style in
No, I suppose
resonating.
you're right, Aaron. It's not about being good or bad. It's about whether this is something you really have a passion for or you don't. And if you don't have a passion for nursing that perhaps you wanted to have and don't have, that does not make you a bad person. Now, on the other hand, we have to always guard against the careless nurse, the one that doesn't really see that standards matter or thinks this will do. And if you can't unpick that and reframe it, which rather goes back to the unlearning and relearning question, then you realize there's someone who perhaps this shouldn't be their profession. And we always have to guard against that, because it may be just a minority, but they may be there. And we need to be able to recognize it and support them to say, perhaps this is not your career, and see what skills they've got to fit somewhere else. I don't know if that answers the same question, but what's regarding Indian nurses?
So let's move on to the next one. When mentoring, how can educators approach difficult conversations with new staff or students who may be overconfident in a way that encourage growth without discouraging them or diminishing their confidence?
Yes, that question immediately took me back to an experience with a student on a urological ward that I had a few years ago. She was a brand new student nurse, and I think she'd had a community placement, and this was her first hospital placement. And I expect a highly motivated student nurse to be anxious, because if they're anxious, they care. If they're worried about what's going on, they want to do well. And what I found quite disconcerting was saying to this student when I got through the door, I said, how are things going, V? You know, and she turned to me and she said, I hope you will all understand, but it was her expression, it's a breeze, Tonks, it's a breeze, which meant not a problem. And that was not what I wanted to hear. I expected it to be a challenge. I expected it to be something that she was uncertain about, loving, but still slightly stressed. And because that means, you know, the Yerkes-Dodson curve or achievement means that you're slightly stressed, your performance will improve. So the student who said it was all a breeze and she didn't have a problem was confident. She was loving her nursing and she was confident, and she went on to be an extremely good nurse. But I had to slightly unpick that without destroying her confidence that she could do it, to say, you mustn't worry about skills being a little difficult or new to you or taking you much longer than your experienced nurses around you. So without, I hope, taking away her confidence, I allowed her to feel stressful. And I think she thought the best way to be was not to find anything a problem. So I sort of said, no, that's not how it is. You can find things a problem. It's part of learning. So difficult conversations, if they're overconfident, perhaps other things that can be of concern is making decisions that are slightly beyond their level of competence and not appreciating that this actually is a far more sensitive decision to be made than you're assuming. And perhaps you needed to check with your mentor, your charge nurse, your staff nurse support, whether you were appropriate to make that decision. And that's what sometimes overconfidence can do. But sometimes it's just that joy to accelerate on and be a registered nurse. And I says, take your time. You'll be a registered nurse long enough, you know.
I think this is a perfect transition for our next question. This is nursing is a highly purpose-driven work.
Yeah.
The emotional demand can lead to compassion fatigue. How can nurses sustain authentically in their practice, remain inspired in their commitment to patients, and at the same time protect their own well-being?
That's such a good question. I don't know who said to you that was such a good question. And it's so relevant for today's world of nursing care and everything you're doing in nursing now, and the whole global agenda of nursing and how important we are. You know, we're in parts of the world that no other healthcare professional is. But it does take its toll. And the more passionate you are to do well and to give the best of care, the more it will take that emotional strain, what we call the emotional labor of nursing, isn't it? You know, that it does take its toll. And it does, in some, lead to burnout, which means they cared so much and it's all defeated every time because there's too many, too much, and they can't achieve the standards they want. And they will then say, I can't even afford to look at a patient because I haven't got time to deal with the question they will ask me. And that's the first seeds that this is not going well. And it's having that insight into yourself that is so important. So times of reflection and group work can really help legitimating that I feel I cannot care anymore, so that people can demonstrate that this is acceptable, that this can happen to any of us if we're overstressed and it's the burden is too great, but that we need some time out. Because the saddest thing is to see a nurse experiencing burnout, something that the psychologist Seligman called, they become helpless, hopeless, and heartless. And it's awful. They're just getting through the day. They don't want to engage with anything that will stress them further. And it is hard because we've been through COVID. It's now 5 years ago. You know, who knows when another one might appear. But COVID just exaggerated this concern and showed how desperate that burnout could be from caring so hard for so little return and not able to use those wonderful soft skills we talked about earlier because of PPE. And the distress was legion. But we must look after our peers and our colleagues, and we must recognize it in our colleagues and say, you need to have some time away. But I can't have time away because what will the others do if I don't come to work? Do you know? That's the sort of reaction you get because they care. And you don't want them not to care. So you say, no, you need time to rebuild your resilience, to have some time for you. And when you're ready, you can come back. We will sort while you are away. And that in itself will give dividends, because they will come back refreshed, re-energized and ready to go, I think. But it is a hard question.
I think there's still some growth that needs to be done regarding the system. On a side note, on innovation and technology, with the growing use of artificial intelligence in nursing documentation, do you think that it can improve the quality of records and support students in learning proper documentation practice?
That's another very difficult question, because we're all grappling with this at this very moment. I'm always an optimist, and I hope I'm a realistic optimist, but I think AI could do wonderful things, and it could enhance the learning of students. It could improve the placement documentation if scratchy notes, when we tend to use an online system anyway, but could be made to be much more readable and much more communicative of what's going on. I think other things, I think AI is very good for a general picture, but it never deals with the particular. So you might say to a student, using AI, prepare an information sheet for patients that are coming into hospital. And you might get a really nice but very bland information sheet for any patient coming into any hospital in any part of the world. But it might then need to be entirely customized in a way that perhaps AI can't do, or it will need different layers of AI to get something that's really tailored to the particular ward or clinical area you're wanting the information sheet for. In terms of the formal academic role of AI, it can improve the presentation of students' work. But you've got to be careful that it's still their work. So we have a lot to think about. And new guidelines have come out here at the University of Edinburgh to help students understand what is an acceptable use of AI and what is an unacceptable. But I feel it is very dynamic and will change. But the reality is it is here to stay, and we have to use it to our advantage. So it's for people like all of your audience and you and me to make sure AI is used in an ethical, helpful, positive way, and not in a way that might give the impression that that student has learned, but actually hasn't. And so we have to be on the alert to make sure that learning really has occurred rather than has appeared to have occurred.
This leads to a very side note question, which is, do you think that AI could actually replace like nursing educators?
To a certain extent, but it's always a human behind these. Somewhere a human has put the data in, otherwise we really do worry. But I'm not sure it could replace, but for example, you mentioned that I teach clinical decision making. Well, you know, way back, computers were doing decision making. I remember as a student, we were given a receptacle, and this is a long time ago, and we were asked to say, was our opinion that this was a cup or was it a mug? I don't know if this means everything to all of you, but and I had said, no, this is definitely a cup because it's this, that, and the other. And some said, no, it's definitely a mug. One of the classic things was it was a cup because it would have a saucer. If it was a mug, you know, these sort of things. But the computer said what it was. It didn't matter what we thought. The computer worked it out. So you fed in all the features of a mug and you fed in all the features of a cup, and the computer told you what it was. So now, all these years later, we can feed in all the data, all our assessment data, all our clerking data, and AI can make the decision. But if the clinician walks away and says, well, that's the answer, that would be a shame. It still needs the human contribution to this. So to a certain extent, I think it could replace. I think things like materials to support learning could be done so beautifully by AI. But I don't think you can ever replace the human component. You can prove me wrong, but it will change. It will change education across the world. And we
Yes,
have to embrace that to make sure we make the best use of it. That sounds
we are
as though I'm
definitely
escaping out.
observing the the dynamic of the artificial intelligence and us. So for the last questions on my part, what advice would you give to early career nurses who aspire to become educators?
You know, it's interesting that, because I have to confess, I immediately thought about how I became an educator. And I don't think I wanted to be a good nurse. That was really all it was. I just wanted to be a good nurse. And then when I got my first opportunity to support a student when I was a newly registered nurse, this was at St Bartholomew's Hospital in London, which is probably the best in the world. I had this student, and she was nervous, and I knew my ward and all the rest of it. And I suddenly realized how much I enjoyed helping her learn. I didn't know I was going to enjoy it. I'd done a bit of teaching of junior school kids when I was at senior school, but that didn't mean much. And when I eventually got the opportunity to give a class lecture, I thought, I love this. So the first thing I would say is anyone who thinks they want to be an educator needs to look back and ask themselves, why? Do I love this teaching? What is it about it? Is it the actual imparting of knowledge that gives me a buzz, or imparting of a skill? Or is it seeing them develop, or is it all of that? And if you can see that, then you can then pursue your career as an educator. And so I would say that's the first thing, some self-reflection to say, why is it I want to be an educator? And what do I hope to achieve? And I think if I'm giving advice, is to get exposure to teaching in all its various forms, to look at all the different methods of teaching, all the different styles of learning. And if it still fires them, go for it, because everybody likes a good teacher. Everybody remembers a good teacher. And if it's something that you have in your repertoire of skills, go for it. The reality, it may compete with other things in career that you're equally excellent as. And I think that's sometimes a problem in nursing. You could go down the research line and be excellent. You could go down the clinical line and be excellent. You could go down the educator line and be excellent. You could go down the management line and be excellent. Because nurses are often all things to all people in all places and at all times. So, but I hope that helps. I hope lots of you want to be educators.
That's one of the key aspects that driven them all to today's session. So
Good.
now let's move on to the live Q&A segment.
Right. I could see odd questions popping up, but I didn't have time to read them.
There's a lot of questions in the chat box, but if you would like, you can raise your hand, and then if you want to unmute yourself,
Oh, that would be lovely.
is there anyone that...
Yes,
Good.
yes. I would like to ask
hello.
a question.
Okay. Fire away.
Okay, my name is Dr. Consolata Kirigia.
Lovely.
I'm the Dean School of Nursing, University of Embu, Kenya, a novice leader. And I'm expected to deliver and make the school great. I know what I mean when I say great. As a leader, everybody wants to see your performance. How would you advise me?
What, to be a good leader?
Yes. Make the school grow.
Probably these days, and it does change because context and histories affect leadership styles, but at the minute, as you'll be very much aware of, the notion of transformational leadership is really effective, so that you bring your team with you, however big, however small, that they feel they're involved in the program that you're leading, that their voices are heard, that they feel they can share with you being change agents, that they're respected. So that if you lay out your credo, your mission statement, that it reflects what they would all support, so that your team has a shared philosophy behind the education, the learning of students. And it actually doesn't take a great deal to engage with your team. You don't want to be a remote leader, but you are still there to lead and give the guidance, and have to make some hard decisions. because that is life. So it's getting that blend, isn't it? And I'm sure you've got it, but it's knowing that, if I put it very simply, that your team, however small or big, knows that you as their leader are on their side, that you're advocating for them, even in some difficult situations. That's how I would see it. But that your leadership goes sideways and upwards and downwards, you know. But does that resonate with what you would feel yourself?
Yes, that makes me now and gives me some courage. Yes, hard decisions, that has been a challenge. I have to make them they are very hard, but
They are hard.
with the consultations from senior management, I'm able to move step by step.
Yes, and don't try and do everything in a day. Just take it step by step and know that you're getting there, but keep your team with you. So that
Yes.
they're always communication, so that they know and understand, if you've made a hard decision, how you've listened to them, and that they will understand now why you've had to make that hard decision. Equally, a lovely decision, you can share the joys of it, you know.
Wonderful.
Thank you.
Yes. And let's move on to Sana. Sana, I can see your hands up.
Hi, Helen. Thank you. Hello, Dr. Professor Tonks. Thank you for this session today. I am an early career nurse. I graduated during COVID. Um, I would relate to what you said for the initial transition period, the support we need, but I would see myself like more kind of a person-centered nurse, like more on communication, and that's how PPE made me not to do it fully, and actually resulted in me uh, quitting and leaving the bedside for a while because I thought I can't do it. And of course, because it was COVID, the senior staffs were off sick, and then the expectations were very high. When I left the bedside for 2 years and worked as a community digital health nurse, office based, I largely missed my bedside um, skills because I loved that part to do, but I felt I was failed to do it, and this made me to migrate to UK. I got an opportunity to come here, and I worked in community maternity as a nurse, which made me to consider doing midwifery. So I got an admission to do pre-registration midwifery program at University of Birmingham. I'm in final year right now.
Right.
Now, when you say about the one is like a skill-based, competency-centered nurse or a midwife, and one which is more about communication and softer skills driven nurse. So, as a student, for example, I'm still developing my competencies for midwifery core skills. Like I would take my time to learn how to do examination, and I won't be quick at that because I want to do it right. But
Okay.
I have the soft skills to do. But when I'm supervised by a midwife, who is more about competencies and standards and skill rather than considering about talking or communicating, and then that would be a mismatch between me as a student who would value the soft skills more, and then competencies, but the midwife who won't care about communicating but want to get the task done and a very high standard. And then the assessment part comes where she will assess you according her standards and not what you bringing at the table. How do we challenge, or not challenge, but how do we communicate this kind of things, that I need support to build that competency, but
Yes.
it's not like I lack competency because I am a other kind of a professional. But the assessment is based on her standard, which brings that confusion, and it gets very bad. I don't know how to
Yes.
explain it.
No,
Yeah.
you've explained it very well. And I think what you've thrown up, which is wrong, and I hope I didn't give that impression, is that isn't one camp and the other. The competencies and the soft skills, the communication skills are all interwoven. And to be fully competent in any skill, it's got to also demonstrate the communication skills, the interpersonal skills, the patient-centeredness. Otherwise, it's just an objective skill. So all your maternity assessment skills must be a blend of really good physical assessment skills, if you like, and interpersonal skills. There cannot be one without the other. Sometimes when a nurse becomes very competent and very skilled, it's those objective skills that the learner sees and doesn't actually register or notice all those communication skills and the sensitivities and the listening skills that they've got, whilst they're doing the actual physical skill that the student may be learning. So there should not be a distinction between them, prioritizing one over the other. They blend towards a common outcome for good. Does that help you?
Yeah, I think the same way. It's just that for a student to build on the skills and competency would take more time
Yes,
rather than the
yeah.
communication and soft skills. Especially you are already a registered professional and now doing a top of different course. So I have like built those communications. I don't know how nursing is here in UK, but back in Pakistan where we do general nursing, which is 5 years, including 1 year of internship, first
Yes.
year, all first year is basically on building communication skills
Yes,
and
it's the
history
same with
taking.
us. It's the same.
And
Because that's
yeah,
what's so important. If you can't communicate, you're not going to get very far. And so these skills that are invisible, but you'll often find you spend much time with new nurses going over communication skills, and they're saying, when can I learn how to
yeah.
take someone's blood pressure? So you have to blend the two, but don't ever let one be seen as though it was not being addressed. And if you feel that someone is very competent but lacks that human touch whilst they're being competent, then you need to gently draw their attention to that.
Mm-hmm.
And you can do that as an educator of the future, or you can do it by gentle questioning and saying, you know, yes, it was very skilled and it was very well done, but I didn't notice you talking to the individual patient very much, or something like that. There's always a
Right.
way around it without causing any upset. It's that's
Mm-hmm.
the sensitivity is not to upset individuals when you're perhaps trying to slightly change behavior, which was one of the earlier questions.
Thank
I'm
you.
very sorry to interrupt, but we're a little bit running out of time, so I'll give the last question to Darcy, also one of our hub leads for the Western Pacific. Very sorry to Ernest. Darcy?
Thank you so much for your insights this afternoon. I'm actually in my final few weeks of my undergraduate degree at the University of Sydney. So I'm in the home stretch, and
Oh, good for you.
it's been such a perfect time listening to you because it really puts things together. And particularly, you know, you go through those different stages of, you know, starting as, you know, a very fresh student and then you're nearly registered. I suppose for me, like I know we refer to them as soft skills, and I don't love that language because I truly think they're the skills that differentiate us from other health professionals, and they're, you know, nursing's voted as the most trusted profession. And I think at
Indeed.
the heart of who nurses are those soft skills, and they're so essential. Um, and look, in Australia, nursing's fairly young in the tertiary sector when we compare it to things like, you know, medicine. Do you think that, you know, sometimes we can get quite task orientated and we use person-centered care, but, you know, it's not always implemented in its true nature? Do you think that has more to do with our professional culture and our professional identity as opposed to, you know, I suppose ways of educating, or is it a mix?
So your fundamental question is, are we more concerned with competency or the communication skills in the program of preparing you as nurses in Australia?
Yeah, well, I think it's more does because most of my degree at Sydney has really been centered around communication and looking at a person holistically,
Yeah,
not just, you
absolutely.
know, going and giving an injection. But sometimes us as students are still so focused on whether it's the next placement, the next essay, or the next skill.
Yeah.
Has that got more to do with our environment and the culture, or is that just, I
I
suppose, the
think
nature of the game?
I think it's part of nursing development.
Yeah,
You know, when students come into nursing, and I'm sure you remember that, you're thinking, what will I be able to do?
yeah,
Now, you hopefully all your life you've been caring, and you know, I use the soft skills expression as just a shorthand for all the different communication skills. But so many students feel, I can do that. I've got no trouble with that, but I don't know how to give an injection. I don't know how to take a blood pressure. So there's a natural preoccupation with those sort of skills in a learner nurse. But once
yeah,
they've got those skills, this was my message, they realize that they're just tools. They must be done really well, but they're only tools to facilitate you giving the best of interpersonal care. of really giving holistic care, of understanding the total experience of a patient. It's the people that matter, but they aren't so tangible. And while you're a raw student, if I dare use that expression, you see the tangible skills and think, good, I've ticked off that, I've ticked off that. This is difficult to tick off. So I wouldn't say it's part of the culture. I think the American model of nursing and the Australian model of nursing puts greater emphasis on the biological basis of nursing than perhaps in the UK. Not me, I like the biology, but I think as a general statement, seeing students that have gone to nurse in Australia and they have to do some extra courses. But no, I think it's all about the human-to-human connection at the end. I hope that answers your question.
Yeah, no,
but the
thank you.
most important thing is when you get out there nursing in a few months' time, just remember to smile the way you're smiling. It matters. A smile works inwards as well as outwards. And if it's a genuine smile, it can do more than all the business in the world just to smile. And that's what I would call one of the soft things. You just smile. It makes a difference. A hand on the shoulder will make all the difference when you haven't got to seeing a patient that you promised to be back in 5 minutes. Just passing with a hand on the shoulder saying, I haven't forgotten you. That's what I mean by the things that matter. Okay, thank you.
Regarding the soft skill thing, I think we can throw back to the second session of this webinar series with Tatiana Kemi. She spoke something about warm skill instead of soft skill. Yeah, art, love, and pedagogy. And sorry again for the time constraint, so we have to end the session here. I know there's a lot of questions that cannot be answered. So we will leave these questions for all of you to discover and explore in your career.
They can always email me if they want to ask more. If you want to give them my email, I'm happy to answer questions.
Sure. So if that's very, very kind. Then you could forward those questions to the Nursing Now Challenge email, and then we would forward it to Professor Tonks Fawcett. So
Thank
now
you
I'm
so
closing
much.
the session.
I really enjoyed it. I wish I could do this more often. The reach is just wonderful, and I'm just sitting in my office.
And this is like a global scale that we are engaging within this session. So thank you all once again for joining us in this session. And with this event, we conclude our Western Pacific Education webinar series, supported by the incredible team at the Nursing Now Challenge and our program director, Professor Aisha Holloway. Over the course of 4 webinars, we explored 4 important subjects, each contributing to our shared passion for education. I extend my heartfelt gratitude to our esteemed speakers, Professor Sophia Hu from National Yangming Jiao Tong University, Dr. Tatiana Kemi from Aalborg University, Professor Olga Yakusheva from Johns Hopkins University, and Professor Tonks Fawcett from the University of Edinburgh, who masterfully guided today's session.
Been a pleasure.
Recording of all 4 sessions are available on the Nursing Now Challenge YouTube page, so please revisit them and share with your colleagues. Stay connected with us for future events, and until next time, take care.
Thank you.